Good evening to you all.
Good evening.
Good evening.
Good evening, sister.
Good evening, sister.
Let's do a recap of what we did last week. So what did you take home last? Georgina Bonsu and Gloria, since you have unmuted yourself, tell us the story. What did you take home last week? Georgina Bonsu, we are listening. All right, so let's do a recap of what we did last week. I need volunteers. Somebody will say, oh yeah, let's go. Yes, Benedicta, let's hear from you.
Please, last week we did a concept of education, and we said that education is the art of teaching knowledge to others and receiving knowledge to others. And we also said that apart from these definitions, a lot of people came out with their own definition, and we have Plateau came out with its own definition, and Jones Darwin came up with his definition as well. And we talked about types of education, where we said we have formal education, non-formal education, and informal education. Where with formal education, it is structured and its end. So example is the schooling, the institution, they are all formal education. Then with the non-formal education, we said that we have them during seminars, and they also we have them during seminars, and we also talk about the informal education, where he said that it's the life experience and it doesn't end, it's not structured. We have them based on the experience of others and reading of certain books. Thank you.
Thank you. Any other? Yes, Nawara.
Liana. Okay. I'll continue with the nursing education.
Stop the continue and answer the question you want to answer.
Okay. Yeah. I learned concerning the nursing education. It describes formal institutions and preparations in the field of the nurses. And also it is theoretical and practical. Then we proceed to midwifery education, where we said it's a process that trains people with the theoretical knowledge and then the practical skills for them to take care of pregnant women. Then when they are in labor and then when they deliver, like after delivery. It went further to the key aspects which we said, and the key aspects is the process that it focuses on the normalcy. Yes. And there is practical and clinical experience also. It's centered on professional standards also. Then it calls for flows. I will go to the purposes, which we said the purpose is to achieve global goal, then advocate for women. I'll end here.
Thank you. Yes, any other? Any other? All right, I asked the group to also read about the importance of midwifery education as well as midwifery education in Ghana. So let's hear from the groups. Their representative, you tell us the name of your group and then you tell us what you read and what you scribbled down. Yes, Deborah.
Sister, please. I'm from Team James. My name is Deborah Fokria. Please, what I learned, I researched about was that nursing education began before, that was during the colonial era apprentice establishing first formal education and training in Accra. That was in 1928. And it was modeled after the British system. So its development happened between 1957 when Ghana gained independence and 1970. And we said that during that time there were policies such as local training of nurses and Africanization that gave opportunity for further nursing education as well as them taking up nursing roles and positions in nursing education and administration. And there was also emphasizes to train nurses to work in hospitals based on creative health systems, which was colonization legacy. So in 1961, Dosia Kisei, who was appointed as the first nursing officer to run this nursing education. Then in 1963, there was an introduction of first university degree program. Then when we come to the midwifery education in Ghana, that one too, I learned about that it started way back in the Bible. Then its evolvement started to replace TBS to formal education. So in 1917, there were concerns about high mortality among infants. So the government then established committees to investigate the cause. So during the committee work, they reported that poor midwifery practices, especially postnatal care for women and their babies, were the cause of the high mortality rate. So they recommended that there should be maternity hospitals to train more midwives to attend to mothers and babies. So in 1927, government selected two district hospitals in Accra to start the domiciliary midwifery in Ghana. Then by then, African midwives who were trained in England were employed, particularly to train TBAs, practical demonstrations to improve their skills. Then in 1928, Kolebu Maternity Hospital was opened professionally to train midwives. Then in 1930, the first batch from the school graduated. So 1931, midwifery ordinance was established, and the ordinance was established for training, examination, registration of midwives in the Gold Coast. Then in 1932, this midwifery ordinance was passed, and Central Midwives Board was constituted. So with the school, there were two categories that were trained. We have the qualified registered nurses and the state registered nurses. They were both up for training for a period of 18 months. But with the state registered nurses, it reduced to 12 months, which was later reduced to 3 months in the curriculum. So we have three categories of we have three categories. We have the 2-year post-basic, both enrolled and community health nursing program. Then we have the direct midwifery program, which is a diploma for 3 years. Then we have the 4-year degree program for bachelor degree. And this happened throughout Ghana gained independence between 1957 and 1970. Thank you.
Thank you. Yes, any other?
Someone's battery has saved me. You say I said this for my
Mm-hmm. Any other? So only one group, Team James, read. The rest of the 39 groups, they didn't read anything. All right, we move. Yes, Irene.
Yes, please. My name is Irene Aurelia. I'm from Team LIM. So we also read about the importance of midwifery education in Ghana. And we'll look at some of the importance. One is to reduce mortality, maternal and neonatal mortality rate. We do this by equipping midwives with the necessary skills and knowledge they will need in conducting deliveries and taking care of pregnant women from ANC till the mother delivers, including the babies too. So we attempt to, another importance is for midwives to attend to childbirth skillfully. And we also learn about the rationale behind everything midwives do. So we just don't look at the conducting of deliveries only, but how the reproductive system works, how, when you have the know-how, the knowledge about how things should go about, you know when to intervene in case of any emergencies. Then importance of midwifery is to also provide quality in reproductive health and provide essential services such as the family planning methods to our women. So please, that's what we do. Thank you.
Thank you, Irene. That is Team Lem, right? Okay, so Team
Yes,
James
sister.
and then Team Lem. Okay. All right, Benedict Asafo, your hand is up.
Please, I also learned about the importance where we said that it
I am not
promotes
dealing with individuals, so if you don't belong to a group, please stay mute. Yes, Comfort, let's hear from you.
Okay, sister. So this is Comfort Koniteju, representing Team Jonas. So to continue with what my first colleague said,
You cannot
currently
be
in
continuing
Ghana.
with anybody because Irene is not
Oh,
in your group. Learn.
okay,
I
okay, sister.
corrected
So
somebody just now.
okay, sister. So reading on the history of nursing and midwifery education in Ghana, we also came across from the early 2000s, nursing and midwifery education was incorporated into the tertiary education system in Ghana, which was offering the diploma, the degree, and then even to the master's and the PhD degrees that we do now, which in turn has strengthened and has enabled nurses and midwives to attain higher levels in education. And then, so currently, Ghana boasts of about 100 nursing midwifery training colleges across all regions. Then education has moved from solely producing members to ensuring high quality training nurses and midwives who are now abreast with current issues and then how to attend to those issues critically. And then now, so the education system has now moved from the informal care by the TAs during the colonial eras to now a highly regulated and professionalized system, beginning with the establishment of the Kolebu nursing and midwifery training in 1928 to the nursing training college of Kolebu in 1945 to now a higher educational level in Ghana and then across the globe. Thank you, sister.
Thank you. Yes, Ethel.
Yes, sister. This is Team Lot. We also read about the history of midwifery in Ghana, and we also talk about that in the middle of 20 years, the midwifery was practiced at the Gold Coast by private medical practitioners. And these medical practitioners attend to pregnant women in their various homes, which is called the domiciliary midwifery. But it came to a time they filled, but they came to a time one of the members feels that to establish this particular thing in Accra. So they decided to build Kolebu in 1928, where it was built as a chest clinic unit. So they see to the pregnant women at that particular place in Kolebu. And when the time was approaching, they realized that they need to enroll nurses or midwives so that men and attend to their basic needs. So they started it with few members, and as time goes on, it became
Let's listen to Benedicta Safo-Mensah.
a vast this, and they now put it into a training constitution that
Please, Team Arista. We learned about the importance of midwifery education. And we said that one, it promotes holistic care in the sense that the education equips we the midwife with skills to provide cultural sensitivities to care by addressing the social determinants of health and supporting the family through transition to parenthood. And also it enhances maternal and child health outcomes. That is the education equips the midwife to provide essential care in areas like immunization, nutrition, breastfeeding, and family planning to the client. And it also provides quality care to the client. This helps ensure that the midwife is equipped to provide effective evidence-based care, leading to improving the health outcomes of the client. And it's also ensure cost-effective investment in the sense that investing in quality midwifery education is cost-effective strategy to reduce costly and unnecessary medical intervention, making healthcare more efficient to the client. Thank you.
Thank you. Yes, Doris, let's hear from you.
Sister, good evening. Please, this is also Ataniba Doris, same from Team CHRISTA. I want to add it to what my sister said. We also
You
find out
cannot
that
add to anything. We are pressed with time. Respect timelines. Yes, Hannah, let's hear from you.
This is Team Christian. We also read about midwifery education. We found out that before 1957, the TBAs were the ones doing the midwifery training. They were training themselves and others. But after 1957, before the 1957, they passed an ordinance known as the Midwifery Ordinance in 1931 to guide the TBA's work. Yeah. And later, the mission hospitals came in. The SDA, the Seventh-day Adventist Hospital in Kwewu, this is some form of midwifery training for the qualified registered nurses. Then, before the independence era, that was the post-independence era, we had formalization of the training, where the period after the independence in 1987, formal nursing education with government schools in Accra and Kumasi and the mission hospitals continued the training. Then we later had this basic training in 1963 to prepare the nursing teachers and administrators, and also stepped to support the development of the nursing and midwifery education. Then in modern times, we have specialized institutes like the Ghana College of the Nurses and Midwives and the University of Ghana School of Nursing and Midwifery. Also introduced the Bachelor of Science program, also to help in the midwifery education. Then there was a regulatory framework, that is the Nursing and Midwifery Council. This serves as a statutory body which ensures the highest standards of training and practice for nurses and midwives. And the outcome has been competent, safe, and efficient healthcare professionals to improve client outcomes and improve maternal health targets. That is what CPC means.
All right, let's hear from who was speaking. Was it Hannah? Let's hear from Mabel. Then Faustina, Matilda. The last person to speak will be Elizabeth. Nobody should raise their hand again.
Okay, Doc.
After wasting all the time.
Okay, Doc, my name is Mabel. I'm from Team Commitment. So with regards to the history, when we did our research, so however, in 1899, when the first nursing sister arrived in the Gold Coast, Ghana, few ladies began to trickle into the profession of the nursing in Ghana. Significantly, the number of nurses and midwives increased side by side with the increase of the medical officers, especially from 1952 to 1988. For example, within the period, the population of nurses and midwives increased from 1352 in 1952 to 21,300 in 1988. So the question of the equitable distribution of the healthcare practitioners and nurses in particular has been looked at by several authors. But most importantly, the question of the effective and efficiencies of nursing and professionals in Ghana has had little or no attention by social historians of medicine in Ghana. So most importantly, a comparative analysis of the performance and attitudes of nurses in Ghana with the persona charisma, and achievements of the most celebrated nurses, that's Florence Nightingale, has not been fully studied. So of seminal interest in Akuwumi's higher education for nurses, in which attention is paid to the traditional roles of the nurses and the education which prepares her for that role in the 1970s. So Akuwumi argued that a few of the women had formal education, and those who could read and write were given simple lessons in human anatomy and physiology. So surgical and medical nursing and first aid. They were awarded the Director of Medical Service certificate on successful completion of this training and appointed as second division nurses in the junior civil service. So in the field, these nurses were strictly under medical supervision. So according to Akuwumi, in 1928, midwifery training started in the maternity hospital when newly built in Kwalebu. Girls with better education were recruited into this very readily because the nature of the job was more in line with the traditional roles women were expected to play in the society. So essentially, the nursing professional midwifery care was seen by the Europeans as that which could be easily performed by women. This is indicative of the fact that women are generally perceived to be empathetic and would easily take care of people. These studies perceive that falls within Nightingale's philosophy of nursing. The Nightingale experiment started over a century ago. So before the nurses received no formal education, but rather went through an apprenticeship system, learning about the job and
Hello.
Yes.
So you didn't summarize what you did. You are
Yes.
reading everything. Thank you. Yes, Faustina, let's hear from you. Summary is important.
Sister, please, I'm from Team Mary. We read about the history of midwifery in Ghana. Midwifery in Ghana transitioned from the pre-colonial era, dominated by the traditional birth attendants, that's the TBA, to a modern system established through colonial policies, particularly the Midwife Ordinance of 1931. Colonial efforts aimed to phase out TBA and replace them with the formally trained conventional midwives to reduce maternal and infant mortality, leading to the establishment of organized maternal health service and professionally regulatory bodies like the Nurses and Midwifery Council of Ghana. Despite initial policies that marginalized TBAs, contemporary approaches are increasingly integrated respectfully and culturally sensitive care, recognizing the value of traditional practices alongside modern scientific approaches.
Thank you. Yes, Matilda, let's hear from you. So why would the Matilda raise her hand, and when she's given the opportunity to talk, she will waste everybody's time? Let's hear from you, Elizabeth.
Hey, sister, I'm from Team Vivian. We read about the importance of midwifery education in Ghana and learned that it came to improve maternal and newborn health through skill delivery for through skill building for safe delivery, early detection and management of complication, promoting evidence-based practices, and family planning. And again, it came to strengthen the healthcare system by enhancing primary health care, reducing strain on hospitals, and improving access to midwifery care for all women at all areas. We also learned that midwifery also came to empower community through cultural sensitivity and also empowering the local women through TBA training. Thank you.
Thank you. So thank you all those groups that were able to make their contributions. Thank you so much. All right, so we heard people, few of us talking about the importance of midwifery education, and then we also heard people talking about midwifery education in Ghana. When I ask you to read something, whether you are to read as a group or as individuals, read them and make a summary. When we say you should make a summary, you look at things that are important, so you don't go about writing everything. This is the beginning of how you write your own notes. So you summarize important things that needs your attention. These days, what I do is that when you talk, I don't mute you. I remove you from the class for the day. So I know that people are on your main platform saying they have been removed. Yes, I removed them. You cannot come to my platform with iPhone. At this time, you still come to a platform with iPhone Grace, iPhone alone, Samsung, Techno. These days, apart from the beginning of the semester that I said, change your turn, these days I don't say anything. I just scroll through the participants session and then take you away. I remove you totally away from the class for the day because I believe that some of you are not ready for any lecture. Some of you think that, I don't know whether you think you are above the law or you play the ignorance, or sometimes, you see, ignorance is not an excuse. You can't do a whole year and then come back the following year and come to mess up. And we cannot be repeating things all the time. So for my class, personally, if you come with a single name, you see, those of you that have only the index number, I even pardon, because yes, it's the index number. But those of you that write your first name and add the index numbers, I take you out of the class. What kind of lazy life is that? If you can write your first name, then why not add the surname before you add your index number? Some of you are just lazy people. You are lazy, you take a system for granted. You think that is a so me anything I take. Me, my class, dear, I will not. It's education. Education comes with discipline. Education comes with discipline. If at this level you still enter a classroom with Samsung, then you have to be removed from the classroom. We will not tell you to change your name from the Samsung to whatever. I will remove you from the classroom. It simply tells me that you are not ready. So reps, center reps, tell your classmates. People take systems for granted. Is it difficult? Is it a very difficult thing to do? That Philippa and Faustina stay mute. Is it a difficult thing to do? Why will you unmute yourself to come and do what? Meanwhile, when I ask people to do a recap of what we did last week and to even say something, you were mute. That's when you stay muted. So why are you unmuting yourself? What are you using the unmuting for? I know that they are complaining there that they have been removed. I did. And the funny thing is that when you are removed, you cannot come back that day. You cannot come back that day. So assuming there is a test, you will miss it and you score 0. Just give whatever device that you are using, give the prompt that this is what I want to be seen anytime I log on the Zoom, and it does that. There's no need going back and forth to change your name every time you log on the Zoom. There is a session that asks you, do you want me to remember this name? Just tick in that box and it will always remember your name, that official name plus your index number. It will always remember it for you. All right, so this evening, we are looking at learning theories. We are looking at learning theories. We are looking at learning theories. That is the unit 2. We are looking at learning theories. You see, when it comes to learning, people think that they know how to learn. People have different ideas about what learning is. So this evening we are going to unravel what learning is by authorities. When somebody was trying to give us a recap of what we did last week, I heard the person say that people define. They are authorities. The Plato, the Einstein, they are authorities in educational psychology. They are authorities in the field of education. Like when you talk about nursing, you are talking about Henderson and the rest, and Nightingale and the rest. When you talk about BSc, higher or nursing education in higher institution, we are talking about Acumi and Co. So they are authorities. They didn't stay there somewhere to define education. So get it right. All right, so in this unit, we are going to look at the behaviorism, session 1, session 2. We'll talk about the cognitivism, session 3. We'll talk about the constructivism theory, session 4. We'll talk about the humanistic theory, and session 5. We'll look at the social learning theories. Then the session 6, we will talk about individual psychological differences. Why is it that we all sit under the same lecturer, read the same lecture notes, write the same lecture exam, the same end of semester exams, be in the same groups, but we have different grades? So at the end of the unit, you'll be expected to describe learning theories, and this should be evidenced by your ability to discuss the differences in the various definitions, list the theories of learning, explain the principles underpinning each learning theory, and discuss how each learning theory applies in the midwifery education. Now let's roll. Like I've already said, people have different ideas when it comes to learning and how people actually learn. And therefore, educational psychologists have viewed learning from different points, and their findings in explaining the learning process have led to different theories. And we see, with regards to these theories, they serve as a guide in the teaching and learning process. And so they serve as a framework. They serve as a framework of the structure and principles that pay attention to the explanations of how people learn. So these learning theories actually deals with principles that explains how people acquire, how people organize, and how people record knowledge and skills. And therefore, when you understand these learning theories, you can better understand how learning occurs. And I believe that when you get to understand how learning occurs, you will not be forcing yourself so much to learn, but you know how to learn. And also, these principles of the theories of learning also can be used as a guide in selecting the instructional tools and then the techniques and strategies that promote learning. Now, let's look at learning, the definition of learning from just two people. You can also go on the internet, the YouTube, to get current definitions when it comes to learning. Now, according to Driscoll 1994, he says that learning is a persisting change in human performance, which is brought about as a result of the learner's interactions with the environment. And the environment that we are talking about can be the formal, the informal, as well as the non-formal environment. That is the education space, the learning space. And then Meyer says that it is a relatively permanent change in behavior, a relatively permanent change in a person's knowledge or behavior due to experience. As you went through the midwifery experience, before you went into the midwifery training college, you didn't know anything about midwifery. You didn't know anything about how to assist a woman to give birth in the labor room. But through the experiences that you got from school, right from year one to year 3, you realize that you had so much experience, the exposure with the practical experience as well, which enabled you to write your licensure exams to pass. And then afterwards, you were posted to the field. And now you can boldly come out with your chest out to say that you are a good practicing midwives. Anyway, some are also lousy. But then we have many, many, many good professional midwives. Now listen to this and then use it as a food for thought as we journey on to look at the theories of learning. Abna is a JHS student at the Erecom region. Abna's problem, huge challenge, is that she doesn't do her homework. And then few times that she does this homework, it is half finished. Aside Abna not doing her homework, in the classroom, whilst teaching is going on, like some of you, whilst we are teaching, you are delivering a woman in the labor room. Whilst we are teaching, you are beating your children. This, when we came, somebody was beating the children. Whilst we are teaching, you are conversing, you are doing something else. Abna is always WhatsApping and taking selfies whilst the in-person class is going on. Abna's teacher, Mr. Mensah, wants her to change because he is worried about Abna. As a JHS2 student who is preparing to enter JHS3 and then going to write an external examination, her behavior is a bit worrisome. And therefore, we are asking you, how can he manage or help Abna to learn a good behavior? At this point, I am asking you, what theory of learning can Mr. Mensah use to help Abna? As we journey on into the theories of learning, have this thought at the back of your mind, and let's see how you are going to apply the principles in each of the learning theories to help advise Mr. Mensah to help Abna. And this brings us to the 5 learning theories that we are going to look at in the second unit: behaviorism theory, the cognitivism theory, the constructivism theory, humanistic theory, and social learning theories. All right, so this evening, let's unravel what the behaviorism theory is all about. This theory was propounded by W.B. Watson, Ivan Pavlov, and B.F. Skinner. And you see, these people believe that learning is the acquisition of new behavior, which is through conditioning. And for them, that behavior that has been learned must be observable. We should see. So when I come to the platform the very first day of the semester, and I tell you that when you come to the platform, come with your official name. If you can add your index number, and you come the following week with a full name, it means learning did not take place, and you have to be taken out. So when we talk of conditioning, we are looking at two types of conditioning, which is the classical conditioning by Ivan Pavlov and operant conditioning by B.F. Skinner. Now, before we look at the two conditionings that helps in the learning under the behaviorism theory, let's look at their assumptions. Every theory have their assumptions. When we are going to school, we say that assuming, therefore supposing that. They assume. Sometimes you assume that something like this. So the behaviorists believe that, or they assume that the environment influences behavior. Anytime I say this, I am laughing, and I say it that almost all parents in Ghana are behaviorists when it comes to selection of schools for their children. We are all behaviorists. You see, every parent, whether the child is weak in academics or not, every parent is selecting the A schools. If it is boys' school, they are eyeing Presbyterian Secondary School, Legon. They are eyeing Infansipim. They are eyeing St. Augustine's. They are eyeing St. Peter's. They are eyeing Opokuwari. They are eyeing Prempeh College. They are eyeing Adisotel. As if these are the only schools, boys' schools in Ghana. Then when it comes to the girls' schools are even limited, very limited. Everybody's eye is on Wesley Girls, Cape Coast. Then the disappointed ones will channel their vim, or they will channel it to a Holy Child. Then the disappointed ones are eyeing seriously Mfanseman Girls. Then when you come to Ashanti region, hey, people are struggling, especially in the Kumasi, struggling between St. Louis and Yasantoa. Believe you me, you see, everybody wants their wards to be in a prestigious school. I've seen people writing their schools, of course. The one that even attended Ochemberry at a secondary school will tell you that my school is the best. And I agree. But then when we are talking about the environment influences the behavior, sometimes you realize that, let's take APO and all those things aside. There are certain schools that if you want to be a good science student, when you go there, you cannot make the mark, because the science lab is even not there. Even if it is there, sometimes some schools have good science laboratories, but they don't even have a good science teacher to influence the learning. So these people believe that in an environment, you can condition people, or you can model people, mold people to respond to certain ways based on their responses, such as feedback, praise, and then rewards. They also believe that learning is described through stimuli and responses. These behaviorists focus on observable events rather than things that occur inside the person's head. And so when I meet you and you size me, When I say you size me, so you show me soro form. Sometimes you say something and say, oh, please, it's not you. It is me. It is me. It is me. So they believe in overt or observable events. The third assumption is that learning must involve a behavioral change. It must involve a behavioral change. Whenever I go to other centers and then they are going to write exams and people come to the exams room with the mentality of cheating, I become worried. And this morning, I was even asking my postgraduate students, why will you come to the exams room? Why will you come to exams with the mentality that you should be given the chance to teach? Why? Why? Why should you have that notion that these exams that I'm coming to write, I am not going to rely on my strength. I am going to rely on somebody. And so whoever is going to invigilate me or whoever is going to supervise me should allow me to cheat. It's not fair. It is not fair. And so these behaviorists believe that learning has not occurred unless there is an observable change in behavior. So I come to Takrady to invigilate, and I tell Takrady students that do this, don't do that. The next time I come to Takrady and Takrady students still behave the same way that they did before they were educated, then you should know that whatever they are doing is intentional. And then you should know that people have made up their minds not to do the right thing. When I come to Tamale Center and I tell Tamale Center students that this is how it should be, you see, sometimes when you go there and you want to do the right thing, the students even see you as an enemy. I don't know how we are going to do this, but in the Kumasi Center, we have cameras all over. When you are writing the exams, we set the cameras. A lot of them don't even know. The cameras are set. This morning, when the postgraduate students were writing exams in the computer lab, we took all of them to the server room and they saw the screen. So sometimes there's no need for even an invigilator in there because we are seeing everything there. Since we don't have our own facilities outside Kumasi, it is even going to be difficult to use these cameras. But I think that the way things are going, these cameras need to be used. It will bring out the evidence. Sometimes you catch somebody and say, I'm not talking. The camera will tell you that you are talking. And they also believe that learning must result when stimulus and response occur close together. That is why it is always advisable. It is always advisable as students that when you close, yes, you are tired, all right, because from morning, from let's say 7 a.m. to let's say 6:30 p.m., you are having lectures, but still find time and rest. Then in the course of the week, before you attend the next lecture for other things to be bombarded on you, you should have read something. You should have, and it will stick. You begin to do this, and you will tell me that during exams, you will not be afraid. The reason why sometimes you become so much afraid is that you do porous learning. You don't take your time to learn, and then most of the time, the time period for you to learn is short, and then you realize that the stimulus, which is the teaching, and the learning that should come close together, you leave it till towards the last end of the semester, making learning difficult. These things that I'm saying, sit down and analyze it by yourself. And so we bring ourselves to the classical conditioning, and this Ivan Pavlov was in the forefront, and the principle of classical conditioning is association or pairing. Anytime I say this, the students will be laughing, especially the research projects that you will be giving your supervisors very soon. Realize that a group of 5, all the 5 people don't understand research. They've gone to group themselves to go and do research work. How are you going to pull it? How are you going to handle it? And it happens all the time. You want to form a study group, and all the members in the study group are weak students, aside that they don't have time to read. So what are you doing? Learning by association. Sometimes you get a strong student group such that realize that their exams mark, even though they are from different centers or they don't sit on the same rows, you realize that they get the marks that they get are very interesting if you study it. And so what Ivan did was that Mr. Ivan Pavlov used a stimulus response theory of learning, and he carried out an experiment with a dog before the conditioning and during the conditioning and after the conditioning. I've shown you a picture which says it all. You realize that food and the dog salivating, the food is what we call the unconditioned stimulus, and salivation is unconditioned response. Naturally, sometimes when people even show food on their statuses, when you see it, it's like, aye. Sometimes when you even see food pictures on Instagram and Facebook and the rest of it, so it's natural. It's natural to see food and then you salivate, which is the unconditioned response. Now, so the dog will see a food, a bowl of food, and salivate. Then you can also show a bell, which is the neutral stimulus, to a dog, and there will be no salivation, because on the ordinarily, bells will not produce any salivation. But what Ivan did was that he paired the ringing of the bell with the food. And so anytime Pavlov rang the bell, he shows the food to the dog and the dog salivated. He did that over a period of time and then took away the food and then rang the bell, because the dog has learned to associate the ringing of the bell and the showing of the food. Even though the food was removed away from the equation, the dog still salivated, because the dog thought that the ringing of the bell came with the showing of the food. And so it's telling us that even in academics, even in the classroom, when a good student is paired, when a weak student is paired with a good student, with time, consistency, even when you take the good student away from the weak student, because the good student have learned to associate him or herself with the best practices from the good student, they will still perform. Any clarifications or any questions at this point? Any questions at this point? All right, Sarah.
All right, thank you, sister. So please, I want to find out, there's always considering the end result. Let's say, for instance, at the end of a semester, and then considering the grade of that person, does it define the person, really define the person as being learned, or does it depict that the person has
Me, I
really
don't
learned?
understand the question you are asking. And I don't know from what angle you are asking the question. I hope you also get me, because I don't know where the question is coming from. And I don't know why that question. So you can reframe your question so that I will understand what you want.
Okay. What I want to ask is, mostly, does the end results shows that the person has really learned? Let's say, for instance, the person
And
taking
what
an end
end
of semester,
results are
and then
you
the
talking
score.
about?
Maybe the
What end
score.
results are you talking about?
I'm talking about the score of that person.
And I'm also asking you what end results and what score. Because the teaching that I'm teaching now, I haven't even linked it to the classroom situation. So me, I don't even understand the score and
Thank you, sir.
what. We are now building something. We'll go to the classroom implications.
Okay.
I just cited an example so people will understand. But where you are coming from, I don't even understand myself. So that is classical conditioning for you. We are saying that people can learn by way of association or pairing. And so in a typical classroom situation, sometimes you see teachers trying to pair the weaker ones with the good ones so that they can actually help them in their academics. And I cited an example that if the group discussion, if you have a steady group discussion, that is, you have a lot of people that are on top there, even the weaker ones can tag along because of the best practices. Because of the best practices. If you are coming from the behaviorist viewpoint, they are saying that your learning, the behavior, the change in behavior should be observable. And therefore, when that individual, somebody who had 40, sometimes you cannot dwell on examinations alone, because exams, a whole lot of things happen. You and I know. So when we are talking about the performance of a student, we don't base the performance on exams alone. No. When we get to assessment, you understand so many things, and you even understand why sometimes external examinations are not favorable. There are a lot of people, because of external examination scores, that is why they are doing the courses or the programs they are doing. So examinations, even so many things, you cannot only dwell on somebody's examination scores to say people are brilliant. I can boldly tell you with my eyes open, sometimes when I sit at the graduation and they mention certain names that they have first class, I question myself, are they first class materials? Because even expressing themselves, writing Quran is a problem. But they have first class because scores. because something favored them, something they chanced on Pascos and they did chew and pour and all those things. So it is not only examination scores that you will look at it and check the improvement of a student, especially a weaker student. A whole lot of things come into play. I hope I have answered a partial thing about what you ask. Then we have the operant conditioning, OC, operant conditioning. And these, the people at the forefront are the Thorndike and B.F. Skinner. And they hold the principle of reinforcement and punishment. The principle of reinforcement and punishment. Yesterday, I had the privilege of getting to know how some of you think when it comes to punishment. And so today, I also will have the view of you people as well. And so for these people, the operant conditioning people, they believe that when people are rewarded or when people are punished, they can learn. That is their belief. So they believe that people actually learn behavior through rewards and punishment. Now let's unravel what reinforcement is. But before we talk about what reinforcement is, let's look at the operant conditioning from their side. So this operant conditioning actually was designed to teach rats how to push a lever. And I tell you that, you know that this behavior is not natural to rats. So they were conditioned with positive and negative reinforcement where behavior was performed to teach them. So what happens is that when the rat is able to press the lever with regards to positive reinforcement, the rat was awarded with food. I realized that before you can actually press the lever successfully, there is also electric shocks in there. And so when it comes to the negative reinforcement, the rat should be able to turn off the electric shock. So what the rat will have to do is that the rat will still have to press the lever. But then as you press the lever, then you will have to turn off the electric shock. It's also a reward. So in all, both the positive and the negative reinforcement is teaching the rat how to perform a good behavior. Now let's look at reinforcement. What is reinforcement? What is reinforcement? But before we look at what reinforcement is, let's look at what reinforcer is. It is a stimulus that is applied after a response is exhibited. And this stimulus strengthens the probability of repeating that response. That is a reinforcer. Now, reinforcement refers to actions that make a target behavior more likely to occur in the future. In simple terms, reinforcement increases a good behavior. And we are saying, like I said, I said before I came to this slide, we have what we call the positive reinforcement and the negative reinforcement. What then is a positive reinforcement? I don't know why I'm sitting here and I'm smiling. A positive reinforcement means adding a stimulus A positive reinforcement is adding a stimulus, while a negative reinforcement is removing a stimulus. I will cite an example with a positive reinforcement. You see, when I go to the Zoom platform, I saw people, you see people with their full names and their index numbers, and they have muted themselves. And I decide to reward such people with a mark of 5. I am telling those people that I like their behavior and I want a repetition of that behavior. So I have rewarded them. And this is what we call the positive reinforcement. Realize that those that I taught, there were some groups that I taught research, there were groups that I taught intro. Realize that in your presentations, apart from you sending your content, a mere raising of hand gives people marks. Sometimes I said, raise your hand at the participants section. So you see people raising their hands there and they get recognized, they get their marks. Somebody will not struggle to look for how to raise the hand at the participant session. The person goes to raise the hand at the chat session and the person is making noise. I was telling your other classmates yesterday that last week when we gave the groups, when the app gave people groups, you realize that before I was going to create the groups, I told you people that I will lock the platform. The reason why I lock the platform these days before I create my groups is this. I know that most of you are not sincere. You know your mates are not attending the lecture. They don't want to come. They don't come. They don't come to school. So anytime I say I'm coming to create a group, in the process of creating the group, you see them calling them, so they will be coming in. Then afterwards, you have people, a lot of about 100 people not getting the group, but they are on the platform. And so when I lock the platform, you can't come in. But the unfortunate thing is that you can go out based on your network. And because when you go out, you can't come in, you will stay out. That's why people will be disturbing you. I was there, I listened to you, but then the moment you started sharing the group, my network took me off. That's why, what can I do? Nothing. That one, if I even want to do something about it, I have to go to the IT people for them to give me the printout for that day so that I can go through and then confirm that you were actually there and give you a group. They should also tell you people that if we want to be mean, we can. So I can actually go there and collect that and go and assign the people that were there that very day, but their network took them off. I can assign them the groups, and the rest of the 200 will stay with that group for the semester. And I will make sure they fail. Because if you don't have continuous assessment, you cannot pass. You will not even be allowed to write exams. Some of you think that this online thing, you have to come and pay fees and be roaming about gallivanting. So every day, ever since I taught you in level 300, you've never successfully joined your own group there. You have not been able to join any group, whether it is you that is joining the group or whether it is the app that has joined you to the group. You have never been able to do it because you know very well that anytime you are about doing class exercise, you are not on the platform. And it is not because you don't have a network that took you off. It's because you don't attend school. We all know. So this semester, welcome to the show. Why? Those of you that sit down and you think that every time you will come with excuses, welcome to the show. Level 400. Welcome. So that is it. So I've cited my example. Now, negative reinforcement. When I teach negative reinforcement, I will not cite any example. I will go and teach positive and negative punishment. Then I will come back to the class to determine whether you have grasped the concept. So let's pay attention. The negative reinforcement involves taking away what the student does not want after a good behavior is exhibited in order to reinforce that good behavior. So what the teacher does is that the teacher takes something unpleasant or undesired away to make a target behavior more likely to occur. I am so tempted to cite an example, but I will hold on. Now, what is punishment? Punishment is a response that is meant to decrease a bad behavior. And punishment can also be positive or negative. So what is positive punishment? Remember that negative reinforcement is taking away what the student does not want after a good behavior. Write it somewhere. Then the positive punishment involves giving a person something that he or she does not want after an undesired behavior is exhibited. That is positive punishment. Write that one also somewhere. Then negative punishment involves taking away something that a person wants. Taking away something that a person wants. We have written all the three down. Now let's do this. If you can cite examples of all the three, fine. That is negative reinforcement, positive punishment, and negative punishment. However, out of the three, if you can do two, fine. Out of the three, if you can do one, fine. It's a brainstorming period, so I will not say anything. Let's get interactive. When I say let's get interactive, I am talking about people raising their hands and talking. If I came here and I started typing everything in the chat box, so those of you that are fond of the moment we finish, we will not even finish talking, we are typing. Today, I want people to be interactive. So let's get interactive. We have few minutes. Let's go. Yes, it is Fauzia. Fauzia. Yes, you have the floor. Or mute yourself and talk. I have limited time, so when I give you the opportunity and you don't do, I take it away and I move.
Good evening, ma.
Don't greet
Please.
anybody. Distance since level 300. We said it. How can you be greeting in the middle of a lecture? Who does that?
Please, I'm sorry. I'm looking at the negative punishment. A punishment in the sense that a child has done something and you inflict pain on the child. That's a negative punishment. Thank you.
What is the example that you gave?
I said
Where
when
is
a
the
child
example?
does something, when a child does
Don't
something
come
wrong,
and explain negative punishment. So you go and sit in exams, and I tell you to cite an example and come and write this. You come out and you think that you have written. You didn't give any example. You are trying to explain negative or positive punishment to us. Come back again, please. Yes, Comfort. You have the floor now.
Okay, sister. So I'll talk on punishment, the positive one. So with that, a student is being punished, is being caned for coming to school late. So
Okay,
next time
please. The
he or she will not.
punishment that I want to hear, I don't want to hear caning in any of the example. I don't want to hear canes. I don't want to hear beatings. Cite
Okay,
example.
sister. Okay, sister. So he came to school late, so he was meant to stay outside the classroom until the class was over. So the next time, to avoid staying outside, the person will not come to class late. That's the positive punishment. And then positive
When we say things, please pay attention. Paying attention in the classroom is also learning.
he does it perfectly.
Why am I not even able to mute her so I can have
So,
peace?
and then he's been awarded.
Comfort, please stop talking. I said, please listen to what I want you to do. So you come and do. Listen to what I actually want you to do. So you come and do the right things. I said negative reinforcement, positive punishment, and negative punishment. I don't want to hear anything about positive reinforcement. Positive reinforcement is not a problem. The challenge here is reinforcement, negative reinforcement, positive punishment, and negative punishment. Yes, Barikisu.
Sister, please, I'll talk about the negative reinforcement. With that one, when a child maybe doesn't perform well during examination, and then you realize that the child likes playing too much of games, you stop the child from playing the games and tell him or her that when he or she performs well, you allow him to play the game. So in the next exams, when he's able to score well, you allow him to play the game. So he will get it in mind that when I perform well in exams, I'll get a chance to play the game. So in that case, you change the results of the child through the playing of the game with respect to the high score in exams. That's the negative reinforcement.
Are you sure? Hold on your thoughts.
All
Let's
right.
move. Jennifer. I'm confused. Jennifer.
Sister,
Elizabeth, let's hear from you.
So, about negative reinforcement. Example, a student will get his homework done when he is being stopped yelling at. So if the person is being kept yelling on, it prevents him from. Okay, let me say it again. Okay, a student stop getting yelled at by their teacher when they complete their homework on time. So if we take the negative stimuli, which is the yelling at, it will encourage the student to complete his homework on time to avoid being yelled at. And positive reinforcement. For example, if a child does his homework, is being given a toffee, then it means the child will keep on doing the homework in order to get the toffee. Thank you.
Esther.
Sister, please, with the negative reinforcement, a student who doesn't attend lectures because we do quiz before the lectures. Now the lecturer decides to take the early quiz in order to allow the students come for lectures. Then later the quiz is being done. Then with negative punishment, you deduct marks for a student who cheats during an examination. You deduct the marks from the ones that he or she will score in order for the student to stop cheating whenever an exam is being conducted.
Okay. Yes, Mary, let's hear from you.
Sister, with negative reinforcement, let's say a child being naughty, so they've asked him to go out of the house, not watching TV. But when he performed good, the mother asked the child to come back and join the family in the watching TV. And talking of positive punishment, awarding a child of what she did best. Thank you.
Yes, Lydia.
Okay, sister. Imagine I have a headache and then I take a pain. I'm talking about the negative reinforcement. If I have a headache and then I take a painkiller, let's say paracetamol, to eradicate the headache, it can increase and then the headache goes away. This can increase my chance of taking paracetamol in the near future if I have a headache without going to the hospital. So I think that one too is a negative reinforcement. Thank you.
Faustina.
Okay, madam. I want to talk about the positive punishment. Like a child that touches a hot stove will feel pain, less likely to touch the stove again. Thank you.
Precious.
I want to talk about the negative reinforcement. So the child do not like to wash plates. So anytime the child refuses to go to school, the mother will make the child wash plates. So this time around, the mother will say, if you go to school, I will not make you wash the plates. So the mother will remove the washing of plates for the child to go to school.
All right. Now, let's look at this. Reinforcement. As I say this, you will now look at what you wrote and said and correct yourself. Today, I will not do any correction. Reinforcement, whether it is negative or positive, will increase a behavior. Have this at the back of your mind. That reinforcement. So I heard people going to take people away and blah, 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 a whole lot of things. But whether it is positive reinforcement or it is negative reinforcement, whatever you add, positive you are adding. So positive reinforcement is easier. Negative reinforcement, you are taking away to increase a good behavior. Just know the caveat. And then with punishment, whether it is positive or negative, you are adding or taking away to decrease or weaken a behavior. I think if you get the two concepts right, if you know that reinforcement is to increase a good behavior and punishment is to decrease or weaken a bad behavior or undesired behavior, citing your examples will be easier. On this note, all groups should do this before 8 p.m. All groups have I logged the platform? Yes, I open it. All groups group C. Okay, yes, that's the right group. So what will happen is that we are doing a very quick teaser. All that you have said, each group, the 40 groups, should write one example each. One example each for positive reinforcement, negative reinforcement, positive punishment, and negative punishment. As much as practicable, if your examples are on the midwifery fraternity, the better. But I need examples. I just want to know whether understanding has taken place. Groups. So you write the name of your team and then you move in that regard. Very, very. I know people don't have a group, but at this moment, I'm talking to people who have groups. At this moment, I'm talking about people who have groups. And the groups that I'm talking about are the people that have the screenshots on the platform. Very soon, I will bring the official names out. So that is it. Now, let's look at conclusions from the behaviorism theory. For the behaviorist, learning is through, or the principles on which they stand on learning is association or pairing, reinforcement, and then punishment. Learning is through the principle of association or pairing, reinforcement, and punishment. And you realize that many people actually get confused, especially with negative reinforcement and punishment. And the caveat here is that for reinforcement, whether it is negative or positive, you are adding or taking away something which is meant to increase a desired behavior. That is the caveat. And then with the punishment, it is adding or taking away something that is meant to decrease or weaken a behavior. Then, when it comes to classroom management, or when it comes to the classroom situation, both the reinforcement and punishment can be effective in reducing specific target behaviors. However, reinforcement is more effective. So in the classroom situation, learn to use both the positive and the negative reinforcement. Learn to use the positive and the negative reinforcement more. And these, when we talk about reinforcement, we are saying that apply it immediately, especially the positive ones. When they do well, clap for them, shine, do that immediately. Then look at also the frequency, because when it becomes too frequent, it will also lose its ability. And then the teacher who is also delivering the reinforcement, you must be enthusiastic. You should show interest, and then you should have variety of them. Sometimes it is clap, sometimes it's a bonus mark, sometimes it's a treat. Those that are about graduating, one member of the class, I even promised to take him to the Lancaster Hotel. I think he's not exposed to those things, so he has been running away since. So he is deferring his reinforcement. So there should be a variety of it. So it can be bonus points, it can be participation points, it can be verbal reinforcement and all those things. And then with the negative reinforcement, it should be immediate and consistent. Show consistency. You can also, negative reinforcement, you can ignore. Like I've seen people writing, we don't have a group, we beg you, have mercy on us. To what end? To what end? So you can use ignoring as a negative consequences for exhibiting undesired behavior, and attention as a positive one. Sometimes you need to give people the needed attention. Then we have punishment. You realize that punishment one thing you should have at the back of your mind is that the punishment will not necessarily eliminate the bad behavior, but it will weaken it. It will weaken it. So that is what you should have at the back of your mind. A student that comes late to school all the time, you see, sometimes if you even let them stay after school, so they came to school 1 hour late, and so after school they have to stay 1 hour before they go. Sometimes they can just reduce it by 30 minutes or some minutes. You not get them eliminating it completely. And so some forms of punishment might include reprimands, contacting parents, losing privileges, and then time out as well. Most of the time, teachers use reprimands to actually talk about, to suppress inappropriate behaviors. But if you are using the reprimand as a teacher, the reprimand should be brief. It should be delivered very close proximity to the student, and then it should be delivered firmly but unemotionally and consistent. You see, the reason why we are talking about beating not being used as a punishment is that you realize that those of us that went to school and were being beaten, the anger with which they beat you, hey, you will get injured. You will get injured. I tell you, the anger with which they will beat you, you will get injured. The way they will beat you, sometimes it's like they are beating you for you to die. They are not even beating you for you to learn sense, but they are beating you for you to die. And so these are some of the guidelines when it comes to punishment, because you see, punishment is to actually reduce or weaken an undesired behavior. So don't say that because the term is called punishment, we are going to punish the person in quotes. That's why you need to do certain things and be cautious when you are punishing. This evening, we try to look at learning theories, and we have started with the behaviorism theory. And then we said that the behaviorism has 4 assumptions. The first one being that they believe that the environment influences our behavior. They also believe that behavior change is through stimuli and responses. And they also believe that these two must also go together, and behavior change must actually happen observably. There should be an observable behavior change. And 2, conditioning that we talked about this evening is the classical conditioning and the operant conditioning. And the classical was propounded by Ivan Pavlov, where he used the dog, a food which is a natural stimulus, salivation, which is a natural response, and then a bell, which is a neutral response. After ringing the bell and showing the food to the dog, when the food was removed away, the dog still salivated, telling us that association learning or learning by pairing can yield fruitful results. Consistency, after you've done it for some time, when you take away the paired, the other thing will still be significant. And then we also looked at the operant conditioning by B.F. Skinner and Thorndike, and then we realized that for them, they believe that reinforcement and punishment actually pushes people to learn, whereas punishment is the adding or removing of a stimulus to weaken or decrease a behavior. Reinforcement is the adding and the removing of a stimulus to increase a desired behavior. And therefore, we also said that in the classroom situation, both reinforcement and punishment can be used effectively, but the more effective one is the reinforcement. And there, we also said that with regards to the reinforcement, it should be immediately. You shouldn't defer reinforcement. And then for punishment, there were guidelines as to how to go about the punishment. Groups, the various groups, the 40 groups have been asked to write an example each on the positive, negative, as well as positive, negative reinforcement and positive, negative punishment, each on the WhatsApp platform, that is official platform of the principles, theories, and practices of midwifery education. Each group is encouraged to do this before 8 p.m. Anything after 8 p.m. will not be accepted. We also use the opportunity to look at it and then correct our mistakes there. Next week, you are all encouraged to be reading on the cognitivism theory as well as the constructivism theory of learning. So next week, God willing, when we come, we are going to look at cognitivism theory, and perhaps if there is time, we will look at constructivism theory as well. On this note, enjoy the rest of this Sunday and have a great start to the beginning of the week. Have a lovely night as I sign off and I say a very good evening to you all. Good night and have a lovely week ahead of us.
Thank you.
Goodbye.
Thank you. Same to you.
Thank you.
Yes, yeah. So when I talk, they will hear everything. So when I
And
want
we
to,
heard, the day we heard. Just leave the platform. We have closed. So leave the platform quietly and go and do your talking so we don't hear. Because when you talk, we hear. Since you are on the platform, when you talk, we will hear. Bye. Auntie Mary. Bye-bye. Patience, one year, I won't remove her. Let her remove herself. Yɛnya baako nso Faustina na ɔtwe ame abie ma me na bɛkasakasa. Kyerɛ sɛ ebi wɔ hɔ a wobɛyɛ wɔn den. They will mute themselves to talk. Ɛwɔ mu mu gyem. Indiscipline. So the Felicia that has raised her hand, why is she raising her hand? I've signed off, I've closed the lecture. So what are you raising your hand for? It's somebody called Felicia.
No, please, I was just trying to see if I can
Raise your
raise my
hand for future use. Okay.
Yes, please. That, mommy. Thank
That's
you.
not bad. There's always room for practice.